So the short answer is no. The majority of sports injuries actually can be treated conservatively. So the most common of sports injuries are things like mild sprains and bruising and contusions, and these usually are problems that heal on their own. Um, if anything is needed for the milder forms of sports injuries, it would be short periods of immobilization or rest, physiotherapy to strengthen muscles, and so supporting a joint, or restructuring of training and exercise. The more significant forms of injuries are the ones that usually need surgery. So the common examples here are things like fractures, for example. But even fractures, sometimes, if they are stable fractures, they can still be treated conservatively with PLAS. So to answer that question, the majority of sports injuries can be treated conservatively. After sports injuries, surgery could be needed acutely, as in very shortly after the injury, or could be needed in a delayed setup, so after a few weeks or months from the injury. So the acute um, setup would usually be needed for things like fractures, for example. So fractures or dislocations, these are acute injuries. If the fracture is displaced or if the fracture creates instability, or is unstable, inherently unstable, these are fractures that usually needs fixing. Similarly, if there is a dislocation, it needs to be relocated and then managed. So these are usually injuries that need acute intervention. Another example that might need acute intervention are things like Achilles tendon ruptures, for example. The majority of Achilles tendon ruptures can be treated conservatively, but if there is a rupture and there is a big gap that is not closing when the foot is positioned pointing downward, these are injuries that might need acute repair. The second setup is a delayed setup for operating. And these are problems that leave the patient with ongoing issues and at the same time issues that are not fixed with the conservative treatment. So the classic example, the most common, is ankle instability, for example. Somebody who sustains an inversion injury, they are sore, the ankle goes black and blue from the bruising, and then they get treated conservatively. They go into a boot or get some physiotherapy, and so, but months after the injury, the ankle is still painful and the ankle is still giving way and unstable. This is a situation that needs intervention. You need to repair the ligaments because repairing the ligaments restores the stability and prevents cumulative damage in the ankle. Another example, for example, is a persistent pain. So somebody who fractured the fifth metatarsal in the foot and the fracture is not healing. Here, the patient will have ongoing pain. So they need some form of intervention. They need usually fixation of the fracture and maybe bone grafting as well. Cartilage lesions, if patients sustain focal injuries to the joint surface, these are injuries that cause a deep, dull ache whenever the athlete starts to exercise again. These again usually need surgical intervention depending on their size and depending on their location. So again, this will obviously depend on what the problem is and what is the actual operation. So to answer this question, I can give you maybe two examples of quite common sports injuries. So the most common of sports injuries is ankle instability. So this is a patient who sustained an injury. They have ongoing pain and they have a feeling that their ankle is not secure. What is involved here is that we repair the ligaments on the outer aspect of the ankle. These are the ligaments that stop the ankle from moving front to back more than it should. Here, these operations are done as day cases. The patient goes in a boot for about 6 weeks. They're weight bearing partially initially, and they start fully weight bearing maybe around the second week or so. And they give up the boot within 6 weeks. Physio starts after the second week and keeps building up to restore strength and stability and balance. And the patients usually can go back to their training within maybe anything between 2 to 3 months. They can start lighter forms of training and progress further. Another example is cartilage lesions. So a cartilage lesion can happen when you sustain a focal injury to the joint surface. It causes a crack in the cartilage, and the fluid from within the joint starts trickling in the bone, raising the pressure of a segment of the bone and causing that segment to lose its blood supply. Here, these lesions can be treated. If they are small, they can be treated with keyhole surgery, so ankle arthroscopies, where we go in and drilling is done to a lesion to stimulate its healing. Bigger lesions need many open approaches, clearing the dead bone and cartilage, filling the gap with bone graft, and covering the lesion with collagen membranes. These reconstructions might need a slightly longer time in the recovery period because the patient needs to be non-weight bearing for a slightly longer period. So they could be non-weight bearing for about 6 weeks here, but they can start mobilizing their ankle again from the second week onward. So other forms of surgery obviously will depend on what exactly is being done. But the two examples that I gave you are one of the most common forms of operations that we do all the time on professional athletes. Now, as you can imagine, there is obviously not a single operation that fixes all sports injuries, because sports injuries can cause all sorts of problems and pathologies. So in principle, the best operation is an operation that resolves pain, that restores stability, that restores the function very quickly or as quickly as possible. And more importantly, it can prevent cumulative damage. So again, I will go to the classic example of the ankle instability, just because it's a very, very common problem that we deal with. And an ankle that is unstable will cause pain, but will more importantly carry a risk of sustaining another injury that can cause further damage. And cumulatively, an ankle that is unstable, if left untreated, will go into arthritis. So you can imagine these injuries happen in young, very active, very fit athletes in their early 20s or so. So give the ankle another 10 years, the ankle could be very arthritic and the patient could still be in their early 30s. It can be a big problem. So here, the surgery to repair the ligaments could be an ideal treatment, because you restore the stability, you improve the pain, you restore the function, you prevent the cumulative damage. This is an example of an operation that has a very high success rate and a very high satisfaction rate in terms of patient-reported outcomes. So the benefits are the points that we just raised in the previous questions. So to improve the pain, to restore the stability, to restore the function, and to prevent cumulative damage. The risks, any operation carries some risks, but the common risks that we discuss with patients are things like swelling, for example. Swelling lasts for a long period of time. It keeps coming on and off, and then it gradually fades away. Infection, superficial infection can happen in about maybe 5% of cases. Here, the treatment is usually just to dress the wound until it heals. Maybe antibiotics could be needed. Deep infection is a bit more serious and needs a bit more intervention, like cleaning the wound surgically, for example. Ongoing pain. Ongoing pain can happen for a variety of reasons. One of them is if the neighboring joints are arthritic or inflamed, if there is still any local complications. So an example would be if there are nerve injuries or if there is infection. These are all causes of some ongoing pains. You can also get things like injury to nerves, for example. The majority of cases, the nerves are just a little bit upset because of the swelling in the vicinity. And in these cases, they usually recover within a couple of months or so. Very rarely, the numbness or the nerve pain can persist. Hematoma formations or blood collections. These are things that can happen if the foot is dangling down for long. It can swell quite a lot. That's why we advise the patients to keep the foot elevated. Clots in the leg. Clots, we take clots very seriously, and therefore we take quite a lot of precautions from our side to prevent clots. But from the patient side, the main thing is to keep up with the elevation, to stay on top of the swelling, to drink plenty of fluids, respiratory exercises to keep their circulation going. We prescribe low molecular weight heparin or blood thinning medications in conditions where the patient is immobilized. Anybody that is going in a plaster or going in a boot for a long period, we would usually give them blood thinning medication. Other risks are generic risks. For example, a bone can fail to heal. Again, that can happen. Now, we're obviously, when it comes to sports injuries, we're quite fortunate that we're dealing with patients that are usually young, that are usually fit, are healthy, and that's why all these risks are actually very, very low in this category of patients.